Psychosis may be caused by number of biological and social factors depending on the disorder underlying the symptom. Trauma and stress can induce short-term psychosis known as brief psychotic disorder. Psychosis can also occur as a result of organic medical condition and neurological conditions, Parkinson's disease, then cerebrovascular disease, metabolic imbalances, and autoimmune disorders, and hallucinogens, PCP, cocaine, alcohol may also induce psychotic reaction. And some of the functional causes include brain tumors, drug abuse, amphetamine, cocaine, marijuana, alcohol, brain damage, schizophrenia, schizophrenic form disorder, schizoaffective disorder, brief psychotic disorder, bipolar disorder, manic depression, severe clinical depression, severe psychosocial stress, sleep deprivation, some focal epileptic disorders, especially if temporal lobe is affected, then exposure to some traumatic event, or rapid withdrawal from certain recreational or prescribed drugs. A psychotic episode can be affected by mood. For example, people experience episode in the context of depression and mania. In context of depression, people may experience self-blaming, delusion or hallucination, while people experiencing psychotic episode in the context of mania may form grandiose delusion. And stress is known to contribute to and trigger psychotic state. A history of psychological traumatic events and the recent experience of stressful event can both contribute to development of psychosis. Short-lived psychosis triggered by stress is known as brief reactive psychosis, and the patients may spontaneously recover normal functioning within 2 weeks. In some cases, individuals may remain in a state of full-blown psychosis for many years. And so we can see that psychotic episode can be affected by mood as well in the case of depression and in the case of mania in both contexts. And some of the functional causes are described as tumor, damage, brain damage, schizophrenia, severe clinical depression, sleep deprivation, severe psychosocial stress, schizophrenia, schizophrenic form disorders. And so we can see general medical conditions as well. Psychosis arising from organic conditions, that is non-psychological condition, sometimes known as secondary psychosis. It can be associated with pathologies like neurological disorders including brain tumor, then dementia with the Lewy bodies, multiple sclerosis, sarcoidosis, the Lyme disease, syphilis, Alzheimer's disease, Parkinson's disease. And so psychoactive drugs also implicated in causing or precipitating the psychotic states. That is, this cannabis has increased dramatically over the past few decades. The use has increased but declined in the last decade, whereas the rate of psychosis has not increased. But both legal and illegal psychoactive substances have been implicated in causing, exacerbating or precipitating the psychotic states. An early phase of schizophrenia, because of the similarities between brief psychotic disorder, schizophrenic form disorder and schizophrenia, many clinicians have to think of brief psychotic disorder as being the precursor to lengthier psychotic disorder. And brief psychotic disorder is often the diagnosis that was used when an individual who later develops schizophrenia experiences a first psychotic break from more typical functioning. Then we can see stress response. At times under severe stress also, temporary psychotic reactions may appear, and the source of stress can be from typical events by many people in the course of a lifetime, such as being widowed or divorced, and the severe stress may be more unusual, such as being in combat enduring natural disaster, and the person return to a normal method of functioning when the stress decreases or more support is available or better coping skills are learned. We can see in postpartum psychosis also in some susceptible women, dramatic hormonal changes in childbirth and shortly after it can result in a form of brief psychotic disorder referred to as postpartum psychosis. Unfortunately, these postpartum conditions are often misidentified and improperly treated. And in many cases of a mother killing her infant or committing suicide, postpartum psychosis is involved. So we can see these psychoactive drugs and in a stress response or postpartum psychosis is also related as a cause of psychosis. And in general medical condition also we can see this secondary psychosis is associated with pathologies like brain tumor or dementia, sarcoidosis, then syphilis, Alzheimer's disease, Parkinson's disease, and functional causes is also there like brain tumors, brain damage, sleep deprivation, bipolar disorder, and psychotic episode can be related means is or experiencing with both depression and mania in both two contexts. In depression, people may experience self-blaming, delusional hallucination, and in case of mania, people may experience in the form of grandiose delusion. Okay, thank you. Bye.